the times we are having a habit of sitting incorrectly without ourselves realizing it. And most of the victims, I would say, is the IT population who are constantly working with their computers, sitting in the wrong posture and coming back to us with these problems. So today, without going into clinical details of the things, there are some simple few exercises which I would like you all to know, and I would try demonstrating it on one of the subjects here. And you can do that as your routine, especially for people who are sitting for a longer time, who feel that the information here is relevant and applicable to them. They can do that. Of course, there is a caveat that if you have any severe major symptoms, please consult us. Don't do any of the exercise, just recognizing that these are your symptoms. So to begin with, now let's first see the wrong posture. The wrong posture is usually people sit slouched, their neck is jutting out, and they are pretty bent in their lower spine. The right posture would be they are just nice and straight here in their lower spine. Their ears are falling in line with their shoulders, and they are comfortably walking where they don't have to really extend their arms to operate the computer, and they are rightly sitting here. The screen is at the level of their eyes. That should be the ideal posture. Of course, sitting in one ideal posture also does not serve the purpose, but you also have to keep moving. You have to be mindful of your body. So here are a few exercises. Now let's look at first a very simple exercise wherein both the shoulder blades are pinched together, as you can see. If I put my finger here, one should be able to hold or grasp them in between the shoulder blades, and she's gently tucking them down as well. So this is first exercise. You hold them for about 5 to 10 seconds and you release them. Second exercise is that, as you can see, would you take the mask off for me for a minute, please? Yeah, as the second exercise you can see that she is trying to tuck her chin inside her throat. So the movement is forward and backward. Many of the times people misperceive this exercise and they start nodding and up, nodding and up. That is precisely a wrong way of knowing it. So the exercise is gently pulling it in and release. Gently pulling it in and release. The third exercise is a stretch, and the stretch position would always be so let's talk about the right neck stretch, wherein her hand is held or she's holding onto an edge. The left hand comes over the shoulder and she passively, meaning with the help of her hand, she's bending her neck to the left, and now she's going to gently pull her right shoulder blade behind and put it down, as in to create some stretch over this tissue, and now she would gently tuck her chin in. That stretches your superficial cervical muscles, that releases the tension on the tissue and the fascia, which is on the side of the neck, and you can hold this position about 10 to 15 seconds and gently release it. Now, while doing these exercises, one should be very mindful that they are not exerting over force, or they are not doing it with an under force. It should be easy, gentle, and be aware of where you feel the stretch. If you are feeling stretch or any kind of tension on the opposite side of your movement, likely you are not doing it correctly. Really relieve the position and get back again. So these are a very simple exercises. Also be mindful about getting up, just moving your head up backwards and coming back to neutral, and that is just a counter movement, I would say, which is as opposed to what you are looking into the computer all the time with your head forward. So that will help ease out some tension over the neck muscles, and that will help you relieve some of the symptoms of dizziness. Of course, if you have more symptoms, please contact us. Please do not do these exercises on your own.